Who knows what amount of money changes hands, or what is the budget of money in UK? Just hazard a guess. 30 billion? 20 billion? 100 million? No. Okay, so I will be talking about the health care business. Most people know I talk about Ofsted and CQC and the like, but like we have said, we are cooking and we are preparing a good package. You can't know. I saw one guy who was at the airport wearing a T-shirt saying which was written, I don't need Google. My wife knows it all. So for me, I can't know everything. So we have got specialists of operating Ofsted, specialists in CQC, specialists in training, and with specialist solicitors, specialist insurance. We bring all of us together to become one. But my plea here is, of all the money which circulates in this industry, there is money which will never come to your table, not because that money is not available. It's because we might not know how to access it. Yeah, true. I saw one video again about some ships which were crossing a road. I don't know where it was, one of the motorway. The first ship which was, I think they jumped the fence, then it jumped on the middle of the motorway. All of them which were following, they were just, but there was nothing there because the first one is jumped. This is exactly what we do. I'm sorry, I will focus on people of African and ethnic origin. Why? Because of 3/4 of you. That is our problem. When someone does something, we want to do it. Because so and so has done dom care, everyone is doing dom care. Because so and so has done supported living or children, everyone. So when you talk of health and social care now, people think health means dom care. Health, it means children's services. But there are a lot of other health-related businesses which we are not tapping into because we are not actually identifying those businesses as if they are health. Sometimes we don't even know. But in the interest of time, let me just show you. None of you was very close. 292 billion pounds.
208.
Well, you said 270, sorry, I didn't hear. There's someone who said 100 million, isn't it? Or 100 billion. Yes. That amount of money changes hands. And from all of you who are here, you need to see, if you are already running a business, what percentage of that is coming and dropping into your account? Not. But remember, not 0.1 of 200 billion is a lot of money. So with that amount of money, it's not all the money which is being spent in the healthcare. Because my topic here is for you, I want you to see the picture of the healthcare industry so that you open your eyes a bit and not only focus on dom care, CQC, Ofsted. There are a lot other industries where you might be aware of it, but you are not classifying it. So if we look, I don't know whether you can see my picture here, it's not very clear. There are categories of money. These are in billions. As you can see, this is the 292, almost the 300 billion. But there has been a decrease, obviously. This time was when COVID recovery and all that was happening. But what I want you to see from that figure is we have got domiciliary, we've got supported, we've got transport, we've got medical, we have got so many other divisions. But how many divisions are we focusing on ourselves? Most likely for the people who are here, it's either dom care or supported living or children. We have got services for transport, which we talked about last time, and I'm glad to see she's not here, both of them. We've got two people whom we have recently registered CQC for their transport, non-emergency. It was after my presentation in Liverpool, some people came and said, you never thought about it. Tell us. We've taken them through, so they are in the process of being registered because they are now branching from the usual dom care. If you are in our groups, you would see we were posting all the tenders for non-emergency transport. There is so much demand. But are we utilizing this knowledge? All we are focusing on is the sector that we know. But my idea is let's be encompassing within the healthcare sector so that you don't just focus, because when people do dom care or supported living, if they are adults, or children and supported accommodation, if they are children's home, if they don't do these four things, they think they are not doing healthcare. But there is so much support for the healthcare industry, whereby you yourselves, you are able to be secondary suppliers of other services rather than just your dom care. Okay. So, if you can see from those figures, very few, if any, none of the people who are here are operating nursing homes. None of you are operating retirement homes. All that is part of the business. But one of the issues might be the barriers to entry. The amount of money required for you to set a nursing home, we do understand the amount of money, but here I'm talking of the opportunities. And as you can see, I think we have got some people who are setting up or running children's services. You can see that money which was allocated, an uplift, because these are annual figures. So there's 600 million allocated social care uplift, of which 90 went to children's homes. But how many people here actually run children's homes? What are the barriers? Why are we not having this? Is it knowledge? Or we are just like the sheep, because the first person has jumped, we know the person has done one, and we are not expanding into these areas. So the opportunities are there. If you see that 81% of the cost there is about hospital care, and we've got 13.8% of private clients. So 13.8 of private spending, it's a lot of money. But how do you get your hands to private money? It's about knowing where to get these customers. During these rounds of sessions, I was talking to some people who are already CQC registered. They've been operating for 6 months. They don't have a client. They are posting on Facebook. They are posting on LinkedIn. And up to now, they are saying we don't have a client. It's not their fault. Because we have talked again, for those whom we work with, we said, I've got my status thing, which I'm always putting on my status, which says social media, posting on social media is not marketing. Just because you've posted on Facebook or LinkedIn, that's not marketing. And when I ask people, how come you are saying you are marketing? Oh yes, I post on Facebook every day. Yes, you are posting, but you're not marketing. You need to have a strategy of, so the money within the sector, health, I think it comes after defense or some of those expenditures. It's an industry, health, where it will never go dry. Political parties come in and come out of power because of health issues, how they manage it. So it is the backbone of the society. But it can only remain the backbone of the society. And if you really look into that budget, I shared the statistics last time, that 80% of the revenue within this sector is being accessed by less than 10% of companies. There are big companies who are taking a big chunk of it. But I'll come back to what Blue Hector talked about with the SPPP. Systems and processes are what is making us not succeed in whichever areas we are. As a result, bigger boys, whom I can call bigger boys, they are getting the bigger pie because they've got the systems in place. So for us to be part and parcel of this 200 billion, we need the systems. We need the growth. Just like what Andrew was talking about, I visit around and audit, and we see exactly the same things. Exactly the same things. 5, 6, 7. Last week I was in an area where I saw exactly what you were saying. They are subscribed to our own company policies. They are subscribed to QCS. They are subscribed to Ronke. All these are policy companies. Why? They've been told by so and so these policies are good. They ditch what they have, they subscribe again. They ditch what they have, they subscribe again. But like an iPhone, it is not the phone which gives you the value. It's how you use the system. So here I am talking about the healthcare sector so that we have got a bigger grasp that as long as we are going to be dominating and focusing on the minority projects which we are focusing on, there are bigger ventures. Even the emergency transport, not even the non-emergency, the ambulance services. If you remember, I don't know whether you read the news, there was so much shortage in the southeast of ambulances. In such, they ended up waiting for 6 hours for an ambulance to come from somewhere, like from Manchester, to go to London because of the shortages. But do we think about these opportunities? Because maybe once we see the blue lights and we close, do we know more? Are we able to explore? Because also we don't want a situation where you just dive into something where you have got no knowledge. So my point here is, let's look at the opportunities within the healthcare sector. Let's understand the functioning, the funding, the various sources, so that from here you go and think, oh, okay, I was focusing on this, but I never focused. Because of this 200 billion, only 30 billion is in the social care. So where are the other billions going? The pharmaceuticals, the medicals, radiography, but servicing various healthcare sectors. So we need to think deeper. If we then begin to specialize, let's do and put systems in place whereby we are the leaders. As long as we don't have systems and we don't have means of monitoring them, we don't have means of staying on top. Why we do what we do, I don't know how many events you go, but the concept behind the Health and Social Care Providers Network, like Wilson has said, we are not doing this for money. If we do it for money, then it might not be viable. What we do it for is to bring people together. What we do it for is, like now, we have Andrew, you know Rumbi, she frequently comes here, but this time she's not here. But because we are creating a network, we have got a new person, maybe for the first time, Shupi. If you stand up so that people can know you, she's also a